Hi, this is Kevin Rollins. This is my advanced pharmacology capstone. I have chosen Nebivolol. Brand name of Nebivolol is Bistolic. And we're going to go over the reasons I actually chose this medication. Okay. Nebivolol's drug classification. It is a beta blocker, as its suffix LOL entails us. It was first approved by the FDA in 2007. Um, Nebivolol is generally a beta 1 selective beta blocker, which means it affects mostly the heart as opposed to the lungs as well, as most non selective beta blockers do. What is special about Nebivolol is it's actually a beta 3 agonist. And what that means is it helps to um, antagonize the reflex that stops overcorrection of the blockade of beta 1 and beta 2. Um, Indications: the only FDA approved indication for Nebivolol is hypertension. Of course, with other beta blockers, off label indications could include heart failure as well as angina. The use of beta blockers, they focus on the nodal aspects of the conduction system of the heart, focusing on the SA, which is the sinoatrial node, as well as the AV, which is the atrioventricular node, from our textbook, Wu and Wright, in 2024. It slows the impulses through these nodes, which slows um, conductivity, slowing the heart rate. A little bit about hypertension and heart failure. Primary hypertension is a multifactorial disease. It doesn't have any real one thing that actually causes it. However, being that I chose Nebivolol, my discussion is going to be more of the cardiac nature. Hypertension goes in multiple different systems, um, and we're going to just stick with the heart since we're on a beta blocker. Hypertension is defined as the pressure expressed on the walls of the arteries with the cardiac output cycle. That's from Rogers, our pathophysiology textbook. Sustained hypertension for prolonged periods can lead to problems such as MI, stroke, left ventricular hypertrophy, dilated cardiomyopathy, heart failure. Hypertension is also very prone to target the kidneys, and that can eventually cause kidney failure. Stages of blood pressure. Our textbook defines blood pressure normally as 120 over 80. A prehypertensive state is anything below 130 over 89. Stage 1 is a systolic, that is 131 to 139. A stage 2 is anything above 140 over 90. And of course, a hypertensive crisis is a blood pressure of 180 systolic over 120 systolic or greater. And that comes, of course, from our textbook. Pharmacotherapeutics, beta blockers in general Nebivolol included, work to decrease contractility, which is the inotropic nature of the heart. It slows down the heart rate, which is the chronotropy of the heart. And something special with nebivolol increases vasodilation. Beta blockers work on antagonizing the receptors that form with norepinephrine and epinephrine to speed the heart rate up, and it blocks those effects to keep the heart rate controlled. Pharmacodynamics. Nebivolol is highly lipid soluble. It does cross the blood-brain barrier. Um, it is a rapid onset medication, usually within 15 minutes of, breakdown in the stomach, reaching its peak of use within 1 to 4 hours. It is nearly 98% protein bound to albumin in the serum of the blood, nearly completely utilized. Its half life is one of the longer half lives of beta blockers, with a 12 to 19-hour half life. Excretion, mostly through the urine. Where it is protein bound, it is also going to be excreted in the stool. It is first pass metabolized through the liver. These information was found in Wu and Wright on page 133, table 1118. Side effects and adverse effects of nebivolol. Generally, very, very well tolerated medication. Um, for the neuro side effects, most of the time, generally with beta blockers, it is dizziness, drowsiness. This can have some insomnia, GI disturbances like every other medication, nausea, vomiting, constipation, diarrhea. Um, there is a chance of decreased libido and impotence, joint pain. Um, so these are problems with adherence. Um, Next, here we have drug interactions. The CYP2D6 enzymes, as well as CYP2C9 enzymes, actually break down nebivolol, and medications that inhibit that will cause an increased plasma level of nebivolol. Calcium channel blockers can potentiate effects of beta blockers just because they do just about the same job: slow heart rate, um, lower blood pressure. So these can be doubled. You have to watch those blood pressures if they're being co-administered. H2 blockers, specifically cimetidine, can increase plasma levels of nebivolol by 23% per Wu and Wright. We have to be careful with sulfonylureas in our diabetics because it can disguise the effects of hypoglycemia. It can take away the jitters and the sweating of hypoglycemics. And also with stimulants and amphetamines, where it is blockading beta receptors, it can cause alpha receptor stimulation, and that can cause excessive bradycardia and hypertension. So we do need to watch that. That goes for our recreational drugs like cocaine and things. That goes for our stimulants as well. Contraindications of nebivolol, as well as most beta blockers, are asthmatics. We don't generally like giving our beta blockers to asthmatics because um, some are more selective for the heart. However, they can be dose dependent, like nebivolol, and at higher doses, they can actually affect beta 2 in the lungs that can cause smooth muscle constriction. So we want to avoid in asthmatics just to avoid that problem. In hyperthyroidism, it can mask the symptoms there as well. So we need to watch that for tachycardia, and abrupt discontinuation can actually invoke a thyroid storm. So we kind of have to watch that with those patients. Our diabetics with hypoglycemia, it can mask those symptoms. So we need to educate our patients that, they need to be monitoring their blood sugars if they start feeling a little sideways. Um, for um, our heart block patients, these can include our type 2 blocks, our second degrees, rather, our third degree block, as well as sick sinus syndrome. We do not want to use these beta blockers, including the nebivolol, because that can affect the rate of the heart, and that can also affect the rhythm, and we do not want to alter those in these higher stage heart blocks. For peripheral vascular disease, this can potentiate problems with arterial insufficiency in the legs, making blood flow worse in there. Touching back on sick sinus syndrome, unless the patient has a permanent pacemaker, per the FDA label from 2023, unless there is a permanent pacemaker in place or an ICD, we do not give beta blockers to sick sinus patients. No matter if they go tachy-brady, we do not treat those with that. Touching on our special considerations, back to our diabetics, we need to monitor their blood sugar closely, because we can lose the symptoms of hypoglycemia with these patients. In our pregnant moms, pregnancy is not a general contraindication to beta blockers. However, if there are better medications, we should utilize those, just because late pregnancy, third trimester, we can start developing problems with baby, neonatal problems such as low blood sugar, bradycardia with the baby, respiratory depression, and hypotension. However, usually per the FDA, untreated hypertension in mommy is usually much worse than the side effects predisposed to the baby. Things like preeclampsia, delivery complications, and a risk of decreased fetal intrauterine growth. Um, excuse me. In our children, nebivolol is not indicated for anybody below the age of 18. There have not been any trials nor studies to conclude safety or efficacy in any teenagers, adolescents, or children below 18. So we will not utilize nebivolol for them. There are other beta blockers that have been tested in children that can be utilized. And another special consideration is our asthmatics again, um, just because of the chances of airway reaction with our asthmatics. We do not want to give them beta blockers if possible. If we do, we want cardioselective. At low doses, nebivolol is more beta 1 specific, so it is a little safer at lower doses. Quickly touch on patient education. We're preaching first, of course, our lifestyle changes. We want these patients exercising, losing weight, better diet, low fat, low salt, decreases the chances of fluid retention. We want these patients to stop smoking, of course. Medication adherence, we want to avoid abrupt stoppage of the medication. We don't want them quitting cold turkey. This could cause a rebound hypertension, hypertensive crisis, chest pain, tachycardia, tachyarrhythmias could precipitate into an EMI. Medication adherence, further on, nebivolol is taken once a day, unless the doctor has you splitting a dose for morning and evening. Then you go by doctor's prescription. We want these patients to maintain recurrent follow-ups because we want to keep a monitor on this blood pressure. We want to report any leg edema, weight gain, or increased breathlessness, as the FDA says this could be indicative of heart failure. And importantly, we want to educate these patients not to stop medications when the blood pressure comes down to 120s, 110s, because this is the medication working. It's helping to reset the body, and we need them to continue this until we get it lined out. Pharmacoeconomics, Bystolic is available as a generic medication. Of course, there is always some doctors that want you on the name brand Bystolic, and that is perfectly okay. Bystolic actually does offer a copay assistance. It could be as low as $15 a month. Um, $15 a month for a 30-day prescription, or um, another for a 90-day. It just depends on what insurance you have and if you can use their copay assistance. Some people, they can write off the medication. You will have no copay cost at all. So it's always important to instruct these patients as well as other providers. Hey, if you're going to look for this medication specifically, check the website and see if they offer this copay card. It just promotes adherence if patients can afford their medicine. There are other beta blockers that are cheaper. Walmart does have the $4 plan. They have a few medications on there for blood pressure as well. If the patient can't do Bystolic or nebivolol, ask them what they can afford. Bystolic or nebivolol is a more superior medication just because of its nitric oxide um, releasing tendencies. It does help lower blood pressure better than other beta blockers. However, if they cannot afford it, they're not going to take it and they're not going to get the benefit of the medicine. So we need to make sure that they have whatever they can afford. And this really concludes